Prime Minister Narendra Modi holds video conference with chief ministers of all states. Most states request Prime Minister Modi to extend the nationwide lockdown. Government says it is considering the request. Active cases across India rise to 6,565 with 239 fatalities and 642 people discharged. Health Ministry says India's response to COVID-19 has been proactive. 586 COVID-19 dedicated hospitals and more than 1 lakh isolation beds set up across the country. Government under process of releasing 12 million metric tons of food grain in 3 months under Pradhan Mantri Garib Kalyan Anna Yojana, considering the exigencies arising out of coronavirus situation. And WHO warns of possibility of deadly resurgence of coronavirus if lockdown restrictions are lifted too quickly. Global death toll goes past 1 lakh with more than 17 lakh cases worldwide. Good evening and welcome to this bulletin. I'm Shubhendu Ghosh. Prime Minister Narendra Modi on Saturday held a meeting with chief ministers of the states via video conferencing to discuss ways to deal with coronavirus pandemic. This was the third time Prime Minister interacted with the chief ministers on this issue. In the meeting, several CMs made a request to extend the ongoing nationwide lockdown by at least a couple of more weeks beyond April 14th. The ongoing 21-day nationwide lockdown to contain COVID-19 crisis announced by Prime Minister on March 24th is scheduled to end on April 14th. Efforts are being made on how the effects of the epidemic can be reduced through innovation and other measures. Central government under Pradhan Mantri Garib Kalyan Anna Yojana is in the process of releasing 12 million metric ton of food grain during April to June. Finance Minister tweeted and said that the government will provide for 80 crore people food grain 5 kg per head per month at no cost. Free ration has already reached 2 crore beneficiaries. Important relief announced by the Finance Ministry for the needy vis-a-vis free food grain. Meanwhile, the government's official fact-checking entity has debunked media reports that claim that Ministry of Railways has issued protocols regarding passenger travel post the lockdown period. The PIB fact-check team tweeted that such claims are speculative and misleading. No such protocols have been issued by the government. PIB also dismissed media reports of shortage of hydroxychloroquine for Mumbai doctors dealing with COVID-19. PIB fact-check team termed the report as fake. As I mentioned earlier, Prime Minister Narendra Modi today held video conferencing with chief ministers of all states, and some of the highlights that came up were chief minister suggesting that the lockdown, the national lockdown that is set to end on April 14th should be extended. My colleague Sudhakar Das, who's been tracking this story, is joining us on phone line. Sudhakar, क्या डिटेल्स हैं जो बातचीत हुई प्रधानमंत्री और चीफ मिनिस्टर्स के बीच लॉकडाउन को एक्सटेंड करने की बात काफी जगह से कही गई?
जी देखिए, बहुत महत्वपूर्ण बातचीत। हमको पता है कि तीसरे दौर का संवाद था। वीडियो कॉन्फ्रेंसिंग के जरिए प्रधानमंत्री जुड़े थे तमाम मुख्यमंत्रियों के साथ, और वो कोशिश कर रहे हैं कि एक टीम इंडिया के तौर पर देश को आगे किस तरह से चुनौती से मुकाबला किया जाए, किस तरह से देश को आगे लेकर जाया जाए। और इस बारे में एक तरह से कह सकते हैं सरकारी तौर पर सरकार की तरफ से जो बयान आया है, जो मुख्य प्रवक्ता जो डीजीपीआईबी हैं के एस दत्तवालिया जी, उनकी तरफ से ये बयान आया है कि वीडियो कॉन्फ्रेंसिंग में तमाम राज्यों के मुख्यमंत्रियों ने प्रधानमंत्री से एक रिक्वेस्ट किया, आग्रह किया कि लॉकडाउन को 2 हफ्ते के लिए बढ़ाया जाना चाहिए और सरकार इस प्रस्ताव पर गंभीरता से विचार कर रही है। तो ये एक आधिकारिक बयान है और निश्चित तौर पर काफी महत्वपूर्ण है। हमने देखा कि लगातार प्रधानमंत्री न सिर्फ मुख्यमंत्रियों से चर्चा कर रहे हैं, तो मुख्यमंत्रियों का भी इस संबंध में बयान हमने देखा। उड़ीसा हो, पंजाब हो, इस तरह के कई राज्यों ने पहले से ही लॉकडाउन बढ़ाने का ऐलान किया है। लेकिन ये किसी एक राज्य का मसला नहीं है, एक क्षेत्र का मसला नहीं है। तमाम राज्य, पूरा देश एक साथ एक इकाई के रूप में काम करे इस मुश्किल वक्त में, वो जरूरी है। और इस लिहाज से तमाम राज्यों ने अपील की है कि पूरे देश में इस लॉकडाउन को 2 हफ्ते के लिए बढ़ाया जाए। तो बेहद ही महत्वपूर्ण आज के संवाद से अगर कोई प्रमुख बात अगर निकल के आई है तो ये आई है। और निश्चित तौर पर मुमकिन लग रहा है कि राज्यों का जो ये सुझाव आया है, क्योंकि प्रधानमंत्री ये तमाम चीजें राज्यों की क्या फीडबैक है, ग्राउंड पर क्या सिचुएशन है, राज्य क्या एक्सपेक्ट करते हैं, तो वो सुनना चाहते थे। उस लिहाज से केंद्र को फैसले करने में आसानी होगी। उस लिहाज से सुझाव महत्वपूर्ण है और मुमकिन लगता है कि सुझाव पर केंद्र गंभीरता से आगे बढ़ रहा होगा।
जी सुधाकर, क्योंकि प्रधानमंत्री और सब मुख्यमंत्री एक ही ऑनलाइन मंच पे थे, तो क्या रिसोर्स शेयरिंग जैसी कोई बातचीत भी हुई? क्योंकि हमें पता है कि सारे राज्य जो है उन पे कोरोना वायरस का प्रभाव एक जैसा नहीं है। दिल्ली, तमिलनाडु, महाराष्ट्र जैसे कुछ राज्य हैं जिनमें प्रभाव काफी ज्यादा है। तो रिसोर्स शेयरिंग से संबंधित कोई बातचीत हुई क्या?
देखिए, रिसोर्स शेयरिंग में दो चीजें। एक तो जो राज्यों को अपने अपने तरह से जो तैयारियां करनी है, तमाम राज्यों ने अपनी तैयारियां की हैं और प्रधानमंत्री इसके लिए लगातार राज्यों से वो अपील भी कर चुके हैं कि इस रूप में स्थिति को नहीं समझना चाहिए कि अभी जो स्थितियां हैं उसी तरह की स्थिति रह सकती है, क्योंकि एक ऐसी तस्वीर है कि लगातार बदलती भी रह सकती है। तो हर लिहाज से तैयारी करना जरूरी है। और हमने देखा यही वजह है कि तमाम राज्यों ने कोविड के लिए अलग अस्पतालों की बात हो, अलग से कैपेसिटी तैयार करने की बात हो, आइसोलेशन क्वारंटाइन सेंटर बनाने की बात हो, वो तमाम उपाय किए हैं। तो उस लिहाज से कह सकते हैं कि हर एक राज्य ने अपनी जरूरत के हिसाब से ये तैयारियां की हैं। तो इसके बारे में लगातार सुझाव भी दिया गया है। दूसरी बात, जहां तक राज्य सरकार केंद्र की तरफ से मदद की बात है, चाहे दवाइयों के तौर पर, चाहे मेडिकल साजो सामान उपकरणों की बात हो, या फिर अन्य तरह से राज्यों को जो पूरी मदद हो सकती है वो मदद दी जा रही है। और सिर्फ इस संवाद के जरिए ही नहीं, प्रधानमंत्री निजी तौर पर भी लगातार फोन के जरिए लगातार हर दिन मुख्यमंत्रियों से लगातार वो संपर्क में है और पूरी जानकारी ले रहे हैं जिस तरह से जो स्थिति है, क्योंकि एक इवॉल्विंग सिचुएशन है और उस लिहाज से फैसले लिए जाने जरूरी है। तो उसकी कोशिश की जा रही है और बेहद महत्वपूर्ण है। हमने देखा कि प्रधानमंत्री के इस नेतृत्व की तरह के चलते भारत ने जो एक कदम उठाया पिछले 2-2.5 महीनों में, उसके चलते भारत जैसे बड़े देश में भी अभी हम इसको अब तक कंटेन कर पाए हैं और एक अहम पड़ाव पर ये पूरा मामला है। तो ऐसे में आज जो मुख्यमंत्रियों की तरफ से सुझाव आया है वो काफी महत्वपूर्ण है।
जी सुधाकर, धन्यवाद आपका इन सभी अपडेट्स के लिए। माय कॉलीग सुधाकर दास गिविंग अस अपडेट्स ऑन Prime Minister's interaction with Chief Ministers of all states through video conferencing. Some of the points that came up was an appeal to extend the national lockdown that ends on April 14th. Moving on, the Health Ministry today briefed the media on COVID-19 situation in the country. Joint Secretary in the Health Ministry, Love Agarwal, said 7,447 total cases were reported and 239 deaths occurred due to coronavirus till date.
अब तक का अगर डेटा देखें तो 642 लोग 642 पीपल दे हैव ऑलरेडी रिकवर्ड। कल 1035 टोटल इंक्रीज्ड केस में नोट किया गया है और जिसके साथ ही टोटल केसेस की संख्या 7,447 हो चुकी है। येस्टरडे 40 डेथ्स वर रिकॉर्डेड और जिसको मिलाएं तो टोटल 239 डेथ्स रिपोर्ट हो चुकी हैं।
The central government has exempted marine and fishing industry from the lockdown restrictions. Along with this, the government has also provided exemption to activities related to trading of fish, although the centre stressed that social distancing and cleanliness be maintained while carrying out the trade in order to stop the spread of COVID-19. With the rising number of coronavirus cases in the country, the forces have also come together to fight this invisible enemy. In addition to CRPF, police, the Indian Air Force is working shoulder to shoulder to supply essential items to citizens. In this fight, Air Force's C-17, C-130, IL-76, AN-32 and Dornier aircraft today dropped essential loads at Mumbai, Bengaluru, Guwahati and Leh. Along with this, it also shifted army doctors from Lucknow to Guwahati. The Air Force is continuously working round the clock to ensure that items such as medical supplies and equipment, disinfectants and medical samples reach the desired destination to assist other professionals to fight against coronavirus. The News Broadcasting Standards Authority of India (NBSA) issued an advisory to news reporters and agencies in respect of interviews of persons kept in isolation due to COVID-19 pandemic in the country. The independent adjudicating body of news broadcasters advised all reporting units of COVID-19 not to enter hospitals or isolation wards where COVID-19 positive cases are kept in isolation to contain the transnational contagion. It also advises not to interview medical personnel so as to not jeopardize the lives of others in the country. In view of the ongoing pandemic of COVID-19, Regional Outreach Bureau of Ministry of Information Broadcasting has initiated a field-based outreach and awareness program through travelling audio announcement system in the rural areas of Maharashtra. Under this program, three-wheelers are installed with pre-recorded audio announcements and messaging to create awareness about corona issue. 20 vehicles have been deployed in different COVID-19 affected districts, which travel some 8 to 10 hours per day, covering a distance of about 50 kilometers each. In order to make messaging more effective, the staff artists have created audio messages and songs in local languages. The audio messages shared through public announcement will focus on taking various precautionary measures to contain the spread of infection, such as maintaining personal hygiene, and will also provide list of essential service allowed under lockdown. Amid the growing tally of COVID-19 cases, people who have recovered from the disease have expressed gratitude to the doctors. These corona survivors are urging people to stay at home.
मुझे बहुत अच्छा लग रहा है, यहाँ से खुश होकर जा रहे हैं हम घर हमारे परिवार के लिए, बस बिल्कुल अच्छा लग रहा है हमारा।
यहाँ पे हमारा बहुत अच्छा ख्याल रखा गया है पूरी डॉक्टर की टीम द्वारा, नर्सिंग स्टाफ, बाकी पूरे हेल्थ प्रोफेशनल्स द्वारा।
बहुत अच्छा लग रहा है, यहाँ के डॉक्टर ने बहुत सेवा करी है, हमारी बहुत ध्यान रखा है और हमने इस बीमारी से जंग जीती है। आप अपने घरों में रहिए, अपना ख्याल रखिए और सब सुरक्षित रहिए अपने घरों में।
In a step to contribute their part for nation's fight against COVID-19, a panchayat in Kathua district has passed a resolution to skip one-time meal so that it can be distributed among the needy people during the lockdown. In the panchayat of around 2,500 people, pregnant women, children, elderly and sick are exempted from this resolution. Every community doing their bit. Researchers at the National Institute of Pharmaceutical Education and Research, Guwahati, have come out with 2 products that promise to be of great help in the fight against COVID-19. The first product is a 3D printed hands-free object that could be used to help open or close doors, windows, drawers and refrigerator handle, or press elevator buttons and laptop desktop keys, including turning the switch buttons on and off. The researchers came up with the design for fabrication of the 3D printed object after a detailed analysis of several resources for its measurement and on how viruses spread through bare hands. In Uttar Pradesh's Muradabad, the migrant workers in shelter homes are being provided yoga classes in order to keep them healthy amid the outbreak of the deadly COVID-19. Social distancing is also maintained during the classes. In Bhopal, a smart city office in Bhopal has been converted into a war room to combat coronavirus in the city. The room provides and records information of suspected COVID patients in the state. A subdivisional magistrate has been given the task to get feedback on treatment of coronavirus infected person and inform the administration on his medical condition. Meanwhile, a data center has been set up for compilation of data on treatment of coronavirus infected persons and those quarantined or kept in isolation. In a major relief for the poor and needy, funds have been allocated to beneficiaries' account under Pradhan Mantri Garib Kalyan Yojana and other schemes in Shivpuri district of Madhya Pradesh. To aid the process of clearance of funds, several camps are being organized at Gram Panchayat level. These camps are efficiently aiding the beneficiaries in withdrawal of their deposits, keeping in mind social distancing. People have been instructed to maintain adequate distance as the beneficiaries stand on designated circles and wait for their respective turns. Fully cooperating with them, bank officials and employees are also taking precaution regarding spread of coronavirus.
कल्याण योजना में जनधन के खातों में 500 रुपए की राशि महिलाओं के लिए भेजी गई है, जो हमारी शाखाओं के द्वारा वितरित की जा रही है। चूँकि बैंक भी आवश्यक सेवा में हैं, हमारा पूरा स्टाफ इतनी परेशानी में वायरस से बचाव करते हुए लगातार उनकी सेवा में लगा हुआ है।
गवर्नमेंट की जो भी गाइडलाइंस दी गई है कि आपको पर्टिकुलर 1-1 मीटर के घेरे जो बनाए गए हैं वो फॉलो करते हुए पेमेंट किया जा रहा है। और साथ में हमें ग्रामीण बैंक सेवा समिति द्वारा किट उपलब्ध कराई गई है।
मैं लोगों से ये कहना चाहती हूँ कि दूरी बनाए रखें और मोदी का धन्यवाद करें, लॉकडाउन करें, उसकी पालन करें और उसको दूर करें।
लोगों से मैं यही कहना चाहूँगा कि जो मोदी जी योजना बना रहे हैं उस योजना का नियम करें, पालन करें। कोरोना वायरस से दूर दूर अपनी सेफ्टी से ही बचाव हो सकता है।
Not only the centre but state governments are also taking every possible initiative to combat the spread of COVID-19. Police in Jangaleshwar region of Gujarat are using drone to monitor lockdowns rule be followed in the state. In Karnataka, Kalaburgi City Corporation organized a health checkup camp for the sanitary workers who are also the frontline COVID-19 warriors. As doctors, the sanitary workers were being advised to take necessary precautions in order to protect themselves from getting infected. As the entire nation is battling with COVID-19 and multiple efforts are being made by government to raise awareness among people, social activist M. Prabhakaran has done his bit in spreading awareness about the disease. The artist painted colourful images of coronavirus on road so that every time a passerby observes it, they need to take necessary precautions. They're reminded of that to fight the deadly virus. In Uttarakhand, police is keeping a strict vigil on every activity across Dehradun. Drone cameras are being used to monitor the lockdown situation, ensure that people are staying at home. Those visuals from Dehradun in Uttarakhand. Petroleum Minister Dharmendra Pradhan has said that India's preparation for petroleum products in the lockdown is well established and widely available throughout the country. He added that the Ministry of Petroleum is delivering gas through pipeline from Ladakh to Kohima to almost 6 million homes. He further added that there is no shortage of cylinders and natural gas during the lockdown.
देश में आज 27.5 करोड़ एलपीजी कंज्यूमर है, उसमें उज्ज्वला भी 8 करोड़ है। बाकी सामान्य एलपीजी कंज्यूमर को आज जैसे लॉकडाउन जैसी स्थिति में डोर डिलीवरी करवाना ये एक बहुत बड़ा जिम्मेवारी हमारे ऊपर है। 60 लाख तक डोर डिलीवरी रोज भारत की लद्दाख हो या कन्याकुमारी हो, कच्छ हो या कोहिमा हो, भारत की सभी राज्यों में सभी यूनियन टेरिटोरी में एलपीजी की डोर डिलीवरी निरंतर जारी रखा गया है।
Amid COVID-19 lockdown, pre-monsoon sowing of Kharif crops has begun across the country, with paddy acreage 27% higher at 32.58 lakh hectares so far as compared to the last season. According to Agriculture Ministry, area sown to pulses has also increased to 3.97 lakh hectares from 3.01 lakh hectares in the said period. Area under coarse cereals has increased to 5.54 lakh hectares so far in the current Kharif season of this year from 4.33 lakh hectares, that's about a year ago. In case of oilseeds too, the sowing area has increased to 6.66 lakh hectare from 5.97 lakh hectare in the said period. Total area planted under all Kharif crops has increased to 48.76 lakh hectare so far this season as against 37.12 lakh hectare in the same period last year. Some international update: more than 1 lakh people have died worldwide from the coronavirus, with nearly 70% of all fatalities taking place in Europe. Data compiled by Johns Hopkins University showed global death toll at about over 1 lakh and the number of confirmed cases worldwide at more than 1.6 million. More than 372,000 recoveries have also been recorded. Italy has registered highest number of COVID-19 casualties, more than 18,000 as on Friday, while United States has reported majority of the confirmed infections, nearly 500,000. However, the number of newly hospitalized patients in the hardest hit state of New York has dropped to 1% increase. World Health Organization warned countries to be cautious about lifting restrictions introduced to curb the spread of the virus. Director General of WHO said that WHO would like to see an easing, but at the same time, lifting of restrictions could lead to a deadly resurgence. He said there had been a positive side to slowing of epidemics in some European countries, including Italy, Germany, Spain and France. However, he mentioned that there had been an alarming acceleration in other countries, including community transmission in 16 countries of Africa.
Some countries are already planning the transition out of stay-at-home restrictions. WHO wants to see restrictions lifted as much as anyone. At the same time, lifting restrictions too quickly could lead to a deadly resurgence. The way down can be as dangerous as the way up if not managed properly.
In Turkey, Istanbul, Ankara and other major Turkish cities locked down for 2 days from Friday midnight to combat the spread of the coronavirus. Restrictions were imposed in 31 provinces across the country and scaled up the existing curbs under which people under the age of 20 and over 65 have been told to stay at home. As the lockdown was announced, people rushed out to buy supplies, forming long queues outside of supermarkets. Turkish authorities called on people to maintain their social distance. The restrictions were imposed in 31 provinces across the country. Also, as we mentioned, scaled up the existing curbs under which people in a particular age group from age 20 years and below and 65 years and above were asked to stay at home. The death toll from the pandemic in Turkey has risen above 1,000. Brazil, the hardest hit Latin American country in the coronavirus pandemic, has crossed the mark of 1,000 casualties on Friday. According to Health Ministry's latest figures, 19,638 confirmed COVID-19 cases were registered in the country, with over 1,000 deaths. Meanwhile, in Amazonas, that's home to more indigenous people than any other state, was badly affected. 95% of intensive care beds were already occupied in the region. According to officials, a teenager from Yanomami indigenous tribe was also among those killed by the new coronavirus. Meanwhile, Ireland on Friday extended its stay-at-home coronavirus restrictions until May 5th. Prime Minister Leo Varadkar said that the curbs had significantly slowed the spread of the outbreak, but more work was required to end it. Ireland has shut bars, restaurants, non-essential retails since March 27th. Meanwhile, Prime Minister also appealed to people not to travel more than 2 kilometers from their homes or visit friends and family until this Sunday. Education Minister Joe McHugh also postponed leaving certificate state school exam from early June until late July. Prior to March 27th lockdown, Ireland had banned all non-essential travel within the country. Confirmed COVID-19 cases in Ireland rose to 8,089 on Friday, with 288 deaths. However, average day-on-day case growth has fallen to 9% from earlier 15%. United States becomes the first country to record more than 2,000 COVID-19 deaths in a single day. Total number of COVID deaths mounts nearly to 18,000, with total number of infections over 5 lakhs in the country. New York, the epicenter of COVID-19 in the US, has registered more than 7,000 deaths and over 1,70,000 positive cases. That has surpassed Europe's worst hit Spain and Italy's infection toll. Meanwhile, President Donald Trump said that he is seeing the downward curve very strongly in New York, and a lot of that has to do with aggressive strategy in saving so many lives. He also said that he would soon set up a new advisory council of doctors and businessmen to recommend when to open America, whose economy has come to a grinding halt due to COVID-19 pandemic. More than 95% of country's 330 million population are under stay-at-home order as part of measures to protect people from catching the infection. And with that, we conclude this bulletin. Take good care of yourself. Namaskar.